Good evening to all of you.
Good evening.
Good evening, sir.
Good evening.
Very good evening, sir.
Good evening. Good evening.
Good evening, sir.
Good evening. Good evening. Okay. Yesterday you could not join.
Yes, sir. I was at client's place and there was some rain. So I was stuck at client's place.
Yeah. I'll just take one call. Meanwhile,
Sorry?
yeah. Can we start the session?
Yes, sir.
Yeah. Okay.
Yes, sir.
Okay. For the benefit of Rohit and others, I will just go through what we have gone through yesterday. Rohit, yesterday was the first session.
Yes, sir.
Yeah. So this is the agenda. We are discussing unsafe. We discussed unsafe acts yesterday. Today we are going to discuss conditions. Tomorrow we are going to discuss the mitigation plans. Day after we learn how to have protocols and audit checklist. And day 5 is how do you make a practice out of it actually. We have considered after brainstorming session, these are some of the thoughts we have compiled. Have a look at it. Let me know if you have gone through it.
Yes, sir.
Can I?
Yes. Yes, sir.
This is the third slide.
Huh. Yes, sir. Yes, sir. Yes, sir.
So these were the thoughts yesterday, and today we are going to talk about. Today we are going. Yesterday we have completed unsafe acts. Today we are going to talk about unsafe conditions. Uh, Parvati, how will you define an unsafe condition?
Um, yeah, I mean, the context around it, right? Any unsafe context or situation that people might be subjected to. So that I would call it as unsafe condition. For
What is a
example,
condition? What is a
yeah,
condition?
yeah. So like, for example, I'm having lunch in cafeteria where minimum 10 people should only go. But, but the place is so small that, it can't accommodate even that, right? So any constraint can become a condition, eventually becoming unsafe. Sir.
Tirupati Rao, what is an unsafe condition? We are trying to understand the meaning. I'm not asking for an examples or condition in itself. What do you understand by unsafe condition? What is the context?
So there will be some background noise. Good evening, sir.
Mhm.
Unsafe conditions. I mean, from organization side, it's not a work environment where we can work safely. I mean, employee safety is taken care of. That's
The
what I.
context is COVID.
Okay.
It's not a general unsafe condition or unsafe act, which is in parlance with the normal occupational health and safety, which we do. This is
Hmm.
purely the context, the boundary is COVID. So,
Yeah, with
what would be
respect
the
to
condition? Yeah,
COVID, unsafe conditions. I
means what?
understand uh, there's no mechanism or no effort put by organization to ensure the social distancing or this temperature checking or any such.
Okay, good. Mahesh, Dr. Mahesh. Yes, Sanjeev Verma, sir.
Potentially, yeah, potentially risky situation.
That is unsafe condition.
Ri- Yeah, risky for catching corona.
Dr. Mahesh.
Can I?
Yes, yes.
That means that the situation is not conducive, it's not a good to be there.
So any non-availability of essential things, right? That can become a unsafe condition. Non-availability of mask, non-availability of disinfectant, non-availability of the towels, non-availability of a schedule of frequent mask changes. All of those will become unsafe conditions.
Not following social distancing.
Hello.
Hello, sir. Vinod here. So, unsafe
Vinod.
condition, some example could be people are not wearing proper.
Not example, sir. I'm trying to understand.
Hello.
Yeah, one at a time, sir. One at a time.
Yes, sir.
Vinod,
Yes, sir.
what does unsafe condition mean?
Where people are not following social distancing or there are.
I think you lost the connectivity. Hello?
Yeah, hello, hello, yeah, hello.
Who's this?
Murli here, please.
Yes,
Good,
Murli.
good evening, sir. Hello, hello.
So,
I'm in,
yeah,
all others are there, I suppose. There was a brief disconnection in the net. Yeah.
okay. So, I just want to know what is the unsafe condition? What does it mean?
Oh, yeah, this is Murli. Hi, everybody. Good evening.
Yeah,
Quick one
good.
before, in that phrase of unsafe condition, first we need to know what is a condition, then we can talk about unsafe condition as well.
Yes.
Condition, in my opinion, would be a sort of a situation or circumstance or the factors that is actually affecting the way in which a group of personnel to live or work or operate, especially with regard to their well-being. That is why that unsafe factor will come. In other words, it's the circumstances or the factors or the situation affecting their performance level in terms of operating. This is condition.
Okay, I'll rephrase the question. The unsafe condition is with respect to situation.
Factors or situations or factors or circumstances.
Situation and circumstances are same, right?
Situations and
Situation and circumstances would remain the same, right?
no, it will not be, sir. I am in a situation driving as a delivery assistant in a highway. That is a situation. Circumstances is the one where the weather is not clear or the petrol truck in front of us got an accident. I'm not able to drive further. So situation and circumstances are different, in my opinion, sir. However, that could be too literal a discussion, please. Yeah.
No, it's okay. I am trying to say before we go to examples and all, I would like to understand, are we on the same page? Unsafe conditions with respect to situations, circumstances, what else?
Or factors.
Can you use another term for this? So that it is understood by my client organization. You and me are consultants, so we can use several words.
Yeah, we can use verbs, but we can pick up the example for each of them. For example, situation, few examples; factors, some examples; circumstances, some examples. So as consultant, we know, and for the client, we can explain. This is what we mean by factors. This is what we mean by situation. So,
okay. Situation, circumstances, factors. Dr. Sridhar. Srujana, Srinivas garu.
So I have background noise, but I would like to attempt. So unsafe conditions can be any risk or hazard where an employee can face any health issues and can be a carrier for COVID.
Good attempt. Anybody else? Dr. Mahesh?
Yes, sir. Condition is a risky situation where we are compelling the individual to perform, in my opinion.
Madheshwaran?
Yeah, I would also broadly go with the risky situation where it leads to the catch up of the COVID-19 because of the.
So Srivatsa here, can I try? Like it is the unfavorable situation in the interest of other people also. So that may be an unsafe condition.
If we can add some more, maybe in addition to what we talked about, is there are very clearly prescribed guidelines. So whether those guidelines are absent, then it becomes the conditions are not safe.
Yeah, definitely. That we have already are going to consider, but I am trying to look at to educate my client organization. Unsafe conditions can be categorized or with respect to situation, circumstances, factors. What more? We'll make an attempt.
I have not understood factors. So situations.
Yeah, that's what I'm saying. Yeah. I have also not understood factors, but we'll take it as we move. But I want to identify some reference, like situation I understand. Circumstances, as he gave an example, I have understood. Factors, yes, we'll consider as and when we discuss about it. Any other context which we should consider for unsafe condition?
Sir, Murli here, if I may add, the factors and situations, whatever I indicated. In addition to that, there are some, there is an environment or a situation which will impact the way in which the person will either work or operate. It is not only for one person, that me as a person, it's going to impact others as well. Unsafe condition doesn't mean it is unsafe only for me. It is for the group of people who are around me. This also I want to add, sir. Thank you.
What do I put here? Unsafe condition with respect to situation, with respect to circumstances, with respect to factors. Any other context which we can build?
It is a scenario wherein more than, one or two constraints can happen, right? And that can contribute to unsafe condition.
So should I call it as a constraints with respect to constraints?
Yeah, maybe if everybody...
We'll try it. We'll give it a try. Because the subject is evolving, so there is no...
So your screen is freezed, I think. We cannot see
correct. Yeah. It's
what
not
you're
good.
typing.
Okay,
If
just
you're editing, we can't see.
Yeah,
you're
now
able
we
to
can
see now?
Yes.
Sorry for that.
Even people, right? People can be a big contributing factor. Okay, I don't need examples, right?
Sir, unsafe condition with respect to measures also. Like measures or compliances.
Sir, can I add something?
Yeah.
See, there is one line of thinking which says that there are no unsafe conditions by themselves. All unsafe conditions arise from unsafe acts done by somebody.
Correct.
When unsafe acts are not properly attended, whatever is left becomes unsafe condition.
Is it? Okay. Thanks, Mr. Mangesh. So, unsafe condition is created by the act of people. That's what you say.
By the unsafe acts of people, maybe.
Yeah, unsafe acts of people.
Yeah.
Mr. Mangesh.
Yes, sir.
It seems you joined a little late today.
No, I'm there from beginning, sir.
Is it? Okay. I missed you. When we implement OSHAs in our organization, we talk about three terms, occupational, health, and safety. Occupational is workplace, health is a state of mind or body, and safety is freedom from risk.
Hazards.
Freedom from risk. That is safety, actually. Risk emerges from the hazards, basically potential hazards. Basically. Now, in this context of COVID, I'm trying to draw similarities because when we are trying to implement OSHAs in organizations in going forward, we have to also consider this dimension of COVID-19 and then pursue our studies actually. So when we conduct so-called HERA study, hazard identification and risk assessment, yeah. So we consider compliances, we consider situations, constraints, I have understood, circumstances, okay, scenarios or circumstances, factors, okay, I'd like to understand that. Any other thing which we consider when we carry out HERA study? Anybody who has done HERA study here?
Possibilities.
Haji?
Possibilities.
Normal and abnormal conditions, like, for example, breakdown and normal servicing or even overhauling.
Okay. We'll keep
So
it
you
simple.
can add interested party concerns.
We'll
I
take it.
think the impact also matters, no? Where the condition of occurrence or its impact also must be considered somewhere.
What situations will lead to unsafe conditions?
Bad housekeeping.
That's a good point.
Sir, Mahesh here.
Mm-hmm.
Awareness among the staff.
Yes.
That could be classified as a factor, I guess. No.
No training.
That's a solution. Poor understanding of protocols. That could lead to a situation.
Untrained.
That will be under poor understanding of protocols, which we are going to talk tomorrow.
Facility.
Murli here, the next
Yeah.
point could be, might be, you can, first is poor understanding of protocol. Second one is, I understand the protocol, but I don't implement. I'm careless, I don't care. That sort of a stuff. So poor implementation of protocols as well.
Non-adherence.
Yeah, thank you.
Good point.
Should we act more than
Low
a condition?
investment. What
No?
about low investment on?
That means not providing the required infrastructure.
You can call it as an inadequate investment rather than low investment.
What should I word it? An inadequate investment on measures. Investments on. How should I frame a sentence?
On preventive measures.
Yeah. Thank you, Sanjay. One more.
Not providing the required tools.
It is part of inadequate investments of preventive measures. If there is, then I don't think people will stop providing. If there is not there, Parvati mentioned about facilities earlier. What was that facility?
Inadequate space availability.
Yeah, inadequate space availability.
Space require lighting.
Sorry. Parvati, you mentioned non-availability of facilities. Will that be a situation?
No, non-availability, it's not non-availability, but
Inadequate.
yeah, inadequate. For example, like, the
Not
space can only hold 4 people, but then, they have to manage
lighting
food and that.
lighting is not adequate.
Yeah, inadequate.
Inadequate facilities is what you meant.
Yes.
Yeah.
Okay.
So constrained facility, basically.
Yeah. That's so. Is it okay? Limited facilities.
Yes, yes.
Sir, Murlis, I want your guidance. What are the circumstances which can lead to unsafe conditions?
Sir, Prakash here.
Yes, Mr. Prakash.
Sir, can we add one more in the earlier slide?
Yes, tell me.
Environment.
What is that?
I'm trying to say the season.
Uh-huh.
Season could be an unsafe condition, like rainy season.
Okay.
High temperature, or maybe very cold.
So should I write a season?
Season.
So Srivatsa here, how about non-display of signages?
Will it be part of compliances or factors, or which will be suiting?
Right. It's like a situation where the things are not displayed.
See, kind of COVID situations, it's always better. Part of compliances, we should have that displays and all kind of things.
Okay.
Circumstance.
You have something to say?
Yeah, circumstance. I'm just thinking about that. So it could be like one's pre-health condition or something like that, right? Person's pre-health condition.
Circumstances means where we are surrounding.
Okay, so I'm just trying to understand the difference between situation and circumstance.
To me, it is same, but
yeah, they can be interchangeably used, but yeah,
it's a thin line. What Mr. Murli said, so we'll go with that. Maybe we'll have few more points on that.
One way it is synonymous.
Yeah. So, but it will enable us to think hard. That's the purpose of think hard to the point of simplicity.
Availability of trained people also will come in the circumstances. For example, pre-health condition.
Mm-hmm. What do you say, Mr. Murli? Availability of trained people.
Non-availability of trained people, and it's like this. The other one which comes to my mind is there are people or personnel who do not want to undergo tests. I'm not sure whether it will come under a situation or a circumstance.
That is a non-compliance.
Yeah, non-compliance. That's all. Okay, we'll go by. Yes. Give me a moment. Let me think of. Thank you.
So can I read out the dictionary definition if it is fine of circumstance?
Yes. Which dictionary?
This is Merriam-Webster dictionary.
No, we only refer Oxford dictionary.
This is standard dictionary for all competitive exams, sir.
Okay, as you say.
At least we get idea, no? So
Yeah,
that's
yeah,
why.
yeah.
Circumstances means పరిసరాలు తెలుగు.
No, sir, కాదు. అది ఏమైనా ఉందంటే కండిషన్, ఫ్యాక్ట్ ఆర్ ఈవెంట్ accompanying, conditioning or determining another event or anything. It is like an essential or inevitable. So that's what it means.
Murli garu, I want to have a debate with you. This neighborhood,
Yes, sir.
the community around, the situation there, would it be a circumstance or a situation?
Circumstance.
Okay. So what should I write it?
A resistance from neighborhood?
Not resistance. What I'm saying is the situation around the workplace organization. Because it's a community where we live or where the office is, the external influence kind of. So how do you?
Yeah, you're mentioning about the environment within the office, within the premises.
But see, the workplace is also get influenced by the things outside the organization. You know.
Oh yeah, yeah.
So either I don't know if you have.
Sir, sorry for interruption. There are two things here. Any sort of a resistance or a non-cooperation, it may come from any internal resources or external sources.
Both.
Within the both, either of them also could be possible. But within the organization, you have protocols. They are compelled to abide by.
People avoiding testing and resistance will fall under one category, my dear sir.
Okay, yeah,
right.
You can group it.
But what I am trying to figure out or put it down is the scenarios around the workplace or the organization, the context around the organization, you know, the surroundings of the organization. That's what helps.
Okay.
The surrounding could be a containment zone.
So within or out?
Outside.
Outside is containment zone, but inside you are talking about
you can say COVID condition in the surroundings.
Sir?
COVID condition in the surroundings.
Yes, that's a better word.
Better. Thank you.
That has a great influence on sir.
Yes.
What about not having testing facility or not able to do the testing for the people?
Will it not be part of preventive measures?
That is unsafe act.
Investment, it will come under investment, is it? Okay. So what I was thinking was, like, for example, if people need to go through the testing and it's somewhere far and it takes a lot of time to get it done, then also it can become a circumstance that they try to avoid it or live without it.
That is for a one-time affair, not a regular day-to-day.
Yeah, but I think
for example, every
many
day
companies, go ahead.
For example, every day your temperature is measuring, oxygen percentage is it's in the premises. They need not go to anywhere. This is within the premises. What we are saying is, initially when they came from somewhere places, they want to say that I am not a COVID country. There is a one time before joining first day after lockdown or something like that.
See, the thing is, people are now distributed in different places, right? As and when they come in from different places into this, wherever the company is, I think there should be a regular mechanism wherein people are able to go through the testing.
It depends because they will ask for self-declaration one.
Yeah, correct. Quarantine, testing, and all of that.
As per government, if you are not having any symptoms, they will not go for the testing.
Okay.
So I'm just captured it, testing facilities away from workplace. Maybe let's see how it shapes up. Any other 1 or 2 points under circumstances? Prakash?
Sir, age.
Sir, this is Murli. If I may try to add one more. When we have everything in terms of typical protocols out there we are implementing, but there could be some external interference at the time of testing, for example, either by the health authorities or by the top management or by the police people or by the neighborhood that will delay our test, that might delay our testing.
Why would that happen? I don't think, I'm just trying to question that thought.
Yeah,
Why would it have to happen? Because
next, sir, whether we should consider that as a circumstance or a situation or not, that we need to keep in view. Then we will analyze as to how to.
no, I'm saying in such scenarios, why external interference will happen?
I'm doing a testing at the main gate, at the security gate. People are coming in queue with the maintaining social distancing. I'm testing their temperature. Suddenly a police vehicle comes and the ambulance comes. People get distracted. So the testing activity gets disrupted. So primarily the title here is unsafe action. This is one example, freak example I'm giving. Thanks.
Well, if anybody comes, they will not disrupt immediately what is going on. They will try to get the information what we are doing and all. They will not normally interfere it.
They will not interfere. That circumstance will cause a disruption. That's what my intention to share that. So, thanks.
I understood the clear difference between
That's my
circumstance
thought.
and
You may
situation.
you may even say that negate, or you may say no also. It's okay, but it's a thought. Thank you. As a collective contribution to this forum. Thank you.
I appreciate, sir. We are only trying to validate it and then make it simple, because the purpose of this sessions are trying to take away with some insights which we can use it in much better way than the people in the organization. That's the whole purpose.
That's right, sir.
We don't want to stand out better, or we don't want to be benchmark. But what we are trying to do is, as auditors or as consultants, we carry some insights which will stand out, and then we'll be able to do some meaningful work
Yes.
for our clients. That's the whole purpose.
Understand.
I don't want theories, and I don't want to refer the existing. The internet is flooded with so much knowledge about it, and if you go by that, then I'm trying to use more of a common sense, which we all carry because of our age and experience and understanding of business.
So Prakash here. Can we say failure to warn the team about safety hazard or maybe pandemic in time? In time warning.
It's not in-time warning. It is
timely warning.
No. In-time warning, people, absence of in-time warning. Is that right, Prakash?
That's right, sir. The workplace congestion.
Sir.
Yeah.
Workplace congestions.
See, workplace conditions we have covered in housekeeping, um, preventive measures, limited facilities. We'll keep it at that. Parvati, you wanted to say something?
Yeah, just a little one, or maybe basic doubt, right? So this whole course is about evaluating COVID preventive practices, but somewhere do we need to bring in business continuity aspect or no?
It will come, no? It will come.
It will come, right?
It will come. See,
Okay.
the flow, logical flow which I have created is this. See, we understand before go to risk assessment, etc. We know what are the acts and conditions which can lead to risk. But these are the risks which are already identified. Then how do we mitigate it? What do we tell the client organization? And having understood, having made this foundation in first 3 days, we'll evolve with the protocols and the checklist, which we'll take it away and try to practice.
Okay, okay. So eventually the aim is to ensure business continuity.
Yes.
And checking
Purpose is
whether all
that.
preventive
Purpose is
practices.
that. Yes.
Correct?
Purpose is that only.
Ah, okay, perfect. Okay,
See,
okay. Thank
protect
you.
our business, protect our people. That's the
Yeah,
purpose.
thanks. Okay.
Sir, under circumstances, can this point come? I think presence of asymptomatic employee in the organization. I mean, who is a carrier, but there are no symptoms, but he can be a transmitter.
ER or OR?
Presence of asymptomatic employee, presence of transmitter, carrier.
ER or OR?
Transmitter, OR, sir, I think.
It is a transmitter, double T. Thank you.
That's a good point, Sujana.
So situations like having to work in a closed place with other people, I mean, that is the work requirement that the place has to be closed and there is some kind of ventilation, but that is not adequate to ensure COVID infection will not transmit.
I'll keep it at Sanjeev sir. Hello.
Yes, sir.
I have deliberately kept that at compliances because as an organization, we need to look at the requirements, statutory regulatory requirements pertaining to workplaces, and then
It is an
that will
actual
take care.
case. It is an actual case. They are working with pencil flames. So a free air circulation is not allowed. They
Yes,
cannot work with free air circulation.
so that's the reason I moved it to compliances.
Yeah.
Because another thing which has of late come in is people have to do the self-declaration mechanism, and many organizations do not have this. Or if it is there, it is more of a superficial or a lip service kind of a thing. The majority of the risk can be avoided with this only, actually. Any other compliances which might lead to?
Sir, can I add one?
Yes, sir.
Not downloading Arogya Setu app.
That is not a must.
Sir, and it is, I feel that it doesn't indicate the right scenario also.
Because you are giving inputs only, then that's only giving it.
No, I don't believe in that actually. There were situations, at least I know of, the Arogya Setu app does not show it very safe, but you have containment zone, and you have people or you have cases coming up there.
As per government also, it is not a must now.
Not question of must. Yeah, okay. Since we are talking about compliances, yes. Okay. Anything else which will fail compliances or which can lead to? Which can lead to unsafe condition.
Sir, one thought came to my mind. Sir Prakash here. We are doing all kind of compliance for the regular workforce.
Yes.
And how about the outsourced services or the contractual laborers?
So whoever has to come to work, they have to follow whether it is regular or like.
It is irrespective of the cadre of people, It is irrespective of that.
Okay.
How do we capture the commuting part of it? Because we all have to travel to workplaces. The commuting part, the parking areas, etc. Where we will handle that? Should be a situation.
It will be situation, circumstances, both, sir. But for commuting, sir, I think there are certain guidelines are there. Like there should not be more than 2%, and that too not on the same seat.
One person, one per seat.
Yeah, one person, one per seat. And even if you are in four-wheeler, then one person has to sit on the back side.
For two-wheelers, only one person.
Yeah. Two.
Will it be a compliance issue?
One way, yes.
Murli, here it is not even one way, sir. I beg your pardon. It is primarily and predominantly compliance issue. Two-wheeler only one person, three-wheeler only two persons or one. That sort of.
And what about the parking? I am not aware of what are the rules and regulations which has been given by government with respect to parking areas.
There is not much guidance, only that the area should be sanitized.
Srivatsa.
Yes, sir. చెప్పండి.
So social distancing between the two planes is also a must, or what? You're from travel industry.
ఇప్పుడైతే లేదు సార్. Currently, flights are all going full because it's Vande Bharat mission. So 100% flights are going full.
So I was just trying to have an. What do we write in parking areas, or how do
Area
we
should be
capture?
area should be sanitized. There is only there is no specific.
Is there a
Parking
rule?
is not specific.
It's not a rule. One way it's safe to do that. There is no rule.
Sir, mainly one thing is not to spit in public areas. That is what take it parking place or any other public place. Should not be spit in any public areas. Sir, and also
Sir.
one more thing, I've kept the difference between situation and circumstances in chat box.
You can openly tell, no, boss. I will not be able to look at the chat box because my mind is focused on interaction. So please.
After this point, I'll just explain.
Yeah.
Sir, normally MSMEs will not have separate parking. And parking is done wherever there is place available. On the street or anywhere.
Okay. We'll go to and fro so that there is a variety into it. Factors, can you educate us, Mr. Murli Ramarao? What factor? You can give me a example so that we can build upon from there.
So may I, in the meanwhile, point to defy rules in commuting. You see, most city transport was bulging with people even before COVID. Now we are talking about social distancing, reduction in transport, and say metro is not running or this or that. So the situation in the public transport is very bad, extremely bad. So the defying rules in the commuting has to be there. There's no way out.
So it will be. So what we are trying to discuss, these are the things which will lead to unsafe conditions. So we are only putting down that these are the I don't know what should I call it, as a factor leading to such unsafe conditions. We're just listing down. It might happen. It might not happen. Constraints. One thing which I've captured is limited parking facilities. And what are the factors which we should?
Can I add one more constraint?
Yes.
Not having adequate work from home devices like laptops and all. Otherwise, they will come back to work. Limited IT facility.
That means is resources.
No, what it will be? It's a. Is it a factor or under which
Constraint.
category? In okay. So what we'll say, or
infrastructure.
Shortage of resources to work from home.
Need not be only work from home.
Yeah.
Can I?
Yes, sir.
For example, Xerox machines. Earlier we are using one. Now because of the social distancing and contacting, we may not able to cater one, more than one. There is also one of the constraint. Not providing adequate space to work with the social distancing, that is also constrained. Availability of manpower to work with the full swing.
Sir Prakash here.
Non-availability of raw materials also one of the constraints. Non-availability of transport, the movement of goods.
Yeah, Murli here. We can generalize as logistics. It's for both incoming and outgoing.
Yes, correct.
Thank you, sir.
Sir, in the limited parking facility, we can also add parking in no parking zone.
One way it's a violation.
Constraint, right?
Yeah, sorry. Compliance, sir.
Where should I put it?
So let it be in compliance.
How does that lead to COVID infection?
Come again, sir. Could not hear you properly.
There's Srivatsav here.
Let that interaction be completed.
Sir, we have some question.
Yeah, parking in no parking zone. How does it lead to COVID infection?
Yeah, generally the COVID, this thing is more observed on metals, and the life also is observed to be high in metals. And if you are parking your vehicle where a lot of movement of there of employees or visitors, it can lead to affect that person.
So Srivatsav here. Okay, I want to add one more thing to constraints is cash crunch for companies, which discourages them to follow all these safety measures.
Ravi, will it be a factor?
I think it will be constrained, no, sir.
Constraint, sir. Very good point.
Very good.
Already.
What is mobilized spelling? Is it right?
No.
LIS.
Sir, is that okay?
Yes, sir. Fine.
Good point, actually.
Thank you. At this point, can I explain situation and circumstance?
Yeah.
Yeah. So actually, circumstances definition is relative position or combination of circumstances at a moment. So condition is actually the cause and situation is the effect. I've taken an example like short circuit can lead to fire accident. So short circuit is the circumstance which leads to the situation of fire accident.
Okay. So
Actually, situation is a combination of circumstances.
Situation is a combination of
circumstances.
Okay. Circumstances lead to a situation. That's what you're saying.
Yeah. Circumstance is the cause and situation is the effect.
Okay. What do you have to say, Mr. Murli?
Yes, sir, I would agree with what Mr. Srivastava mentioned. Short circuit is the circumstance and the fire accident is the situation. This is exactly almost similar to the aspect and impact in the environmental management system, like the cause and effect. That's it.
So we'll have it like this only, right? Situations and circumstance, both are separate.
Yes, sir.
Okay. I think it has come out well, actually, if you see.
Yeah.
See, that's a collective, that's a benefit of collective,
minds.
Yeah. And it looks very simple also, actually, for applications, practical application.
Oh, practical approach.
Yes, sir. Simple, realistic, and business-like. Thank you.
Yes. Because that will help us to really do a risk assessment properly, and once we get used to it, and it's a cakewalk, like we have learned ABCD 1, 2, 3. It gets internalized, So and that's what I'm trying to drive at, actually.
Thank you, sir. And these are the basics that are essential to carry out risk assessment. If we lose anything here,
actually, consultants like us should make things very simple, unlike a lot of knowledge which is there. It should not be scholarly kind of a thing. Good, actually. So we have understood what kind of situations might be termed as unsafe conditions. We have understood what kind of circumstances might be termed as unsafe conditions. We have also understood or looked at, reflected upon what kind of compliances or things related to non-compliances which could lead to an unsafe condition. Self-declaration mechanism, you have to add something. Non-existent. Sorry. Should we write a non-existent self-declaration, or how should we put it?
Absence of self-declaration mechanism?
Not necessarily absence, ma'am, if you beg your pardon. Sometimes I do, sometimes I don't do. I would say laxity in terms of self-declaration. I do one day, next day I don't do. Again, I don't do for 1 week. A laxity or inconsistency in self-declaration.
Yeah, I agree with you.
Thank you, ma'am.
But inconsistency can be termed as unsafe act, no? It doesn't come under unsafe condition.
Non-compliance.
See, my question to all of you is, what should I put? Aage piche kya laga, What should I either put something, a word before self-declaration mechanism or after, which will make sense to me, actually. Like workplace rules, So self-declaration mechanism, what should I write?
Want to say not adhering to?
Sir, can we say absence of self-declaration mechanism?
Absence to do, sir. I think absence is sufficient. Absence of self-declaration mechanism.
Yeah.
It should be for self and family too, no? Somewhere.
At workplace. We're discussing at
Only for
workplace
the
scenario.
employee, right? Only for the employee.
Yeah.
I'm sorry, sir. She's right, because in that declaration also there is a call system available where you have to mention any family back history.
Yeah, if family member is, having any condition, then they might also have to self-quarantine and self-declaration. I think it should have multiple factors in my mind. So
It will have any
it could
foreign
be health,
exchange,
it could be travel, it could be self, it could be
contact with affected
yeah,
people,
any
past
outside visit.
diseases, having diabetes, hypertension, like declaration you have to give.
Somewhere we had someone mentioned about age. Where should I put it as a compliance? Age and health conditions.
I said that it is in compliance because now above people above 60, they are not permitted inside the company.
Today I was mentioning this.
They are not allowing, they are advised to be there only. It's not a company absence from duty.
No, sir. The guideline is clearly mentioned like kids and people above age of 60 years. They are not permitted.
Normally, 58 years is a retirement age in most of the cases.
So that is there in government. In private sector, people are working above 60, 65.
Vinod.
Yes, sir.
You manage 6 businesses. So what are your thoughts on unsafe conditions, considering different verticals you manage in Bangalore, plus all India, because you especially airports and all you manage, right? So what are any points which we have missed out? It would be a value addition. Anything factors or something which I missed out?
One more point for the previous slide. Have we captured the availability of kit for testing? Yeah, I'm talking about testing kit.
Non-availability of kits.
Yeah.
Is it a constraint? No?
It's a constraint as well as compliance.
Sir, how about not following the hygiene? Some example could be uniforms are not washed properly. That also could be one of the factor.
So I feel factors may not have an independent placeholder. They might be contributing to circumstances or situations or constraints.
That is unsafe act.
Yeah, I mean, any factor for that matter, it can contribute to a constraint or to a circumstance or to a condition.
Also, sometimes the security person will, if he's not able to follow the guidelines, example, if any employee is entering, he's not doing proper testing to that employee, temperature test, or he's not asking the employee to wash.
So will it not come here, non-adherence of protocols? It is a part of that, right?
So I think it will take care of that.
Okay, sir.
Ajay Maske, Unmute yourself. Hello. Mr. Ajay.
Yeah, sir.
Good evening to you. You are
Good
joined
evening.
today.
Yeah, just now, sir. Sorry, I was out.
Okay.
Just not on notice.
So you are a safety expert from Pune, right?
Right, but currently since last 4 years, I am working in automotive IITF only. But
Okay,
I am having a huge experience in EMS no chance. And prior to 4 years, when I was in industry.
So what are your thoughts? Because
What happened, sir? Just I joined 15 minutes before.
okay,
I am
no
going
problem.
through it. Maybe I will give my inputs.
Yeah. Good.
Yeah. Sir.
So if you kindly allow discussion on this self-declaration thing, sir, suppose I'm a asymptomatic patient and I declare that I'm perfectly all right. Nothing is abnormal with me. I've not been into any foreign country, etc., etc. But then I end up next day I end up in hospital with COVID. Now, what will the company do where I have given the self-declaration? They cannot do anything about it. I mean, so
Yeah.
it is
So,
not.
tomorrow is a risk assessment, and day after is protocols and audit. I think both will be help us to comprehend our existing knowledge. So today we'll limit ourselves to identifying conditions, unsafe conditions, and yesterday's notes and today's notes will help us for tomorrow and day after's discussions.
Right.
Varma sir. Yeah. Today, let us be focused on only identifying, our thoughts, which will be termed as unsafe conditions.
You're right.
Tomorrow and day after, we'll make it interesting and evolve a system which will be used by us. Even when we are implementing OSHAs and all, it will be definitely useful. Why only OSHAs? Even when you're implementing QMS itself, and when you address the work environment, I think this would be handy actually. So, Mr. Murli.
Oh, yes, sir.
Should we give a pass to factors?
Yeah, we can give a pass to factors, or we can.
Or if you can give me 2, 3, so that we can add on. No, I am willing to, because but we need to understand what it is actually.
Thank you very much. As Ms. Parvati was rightly observed now, but my contention of bringing in the factors is factors are the roots for our situations coming up, and also the compliance, whether we do or not. In other words, there are some base factors at the root of our entire COVID-19 efforts. We need to identify such roots which result in the compliances or whatever we listed in the previous slides, sir. For example, we take one factor, for example, is the competency of our complete COVID team in an organization. All other things are good and perfect, but competency is poor and it goes unnoticed. It is an unsafe situation. It leads to an unsafe situation. This is why I thought I'll bring in the factors. There are a couple of them, like lack of infrastructure, no requisite competency for the COVID team of the organization. For example, for an organization, it is not the managing director or the health and safety manager is going to run around. We need to have a SPOC, one single person to talk about COVID. That's sort of like a management representative, what we used to have in QMS 2008 or so. This is what I was focusing. In other words, factors are the basic root or root cause for all other things to come out or explode. And again, sorry, one more point if I may add. All other resources are available. Infrastructure is available. Compliance I'm adhering to. But is there monitoring? Is there someone monitoring what the people are doing related to COVID control? Is there any evaluation happening or not? So they all will come under the factors which are impacting our situation and compliance. This is my thought, sir. Maybe we can bring.
I'm trying to develop.
Thank you.
Anything related to facilities, accessibility, competency.
Very right, sir. You are right. I would say lack of infrastructure is a basic factor which will impact everything. It is the root. Lack of infrastructure. This is my thought. The team may contribute.
Yeah. Sir, I will say culture, discipline, that will be also part of factors.
Oh, yes, sir. Excellent.
So, just it's a wild thought.
Yeah.
What could so you mentioned these things might be factors: facilities, accessibility, competency, resources. What are the other?
Yes, sir. Ajay here.
Mm.
Culture, I will say culture, discipline.
Yeah, that's right. Culture towards
yeah,
safety and hygiene. You're right. Thank you. Good one. So the culture, I could give a negative example is that everyone, everywhere, all over the world, people are screaming that you wear a mask and then maintain social distancing. But in public, we see in how many places they don't have that culture. They assume nothing will happen to them. Good point, sir. Thank you.
Right. Attitude.
Yeah, attitude. Yeah.
For training.
Training and team. Observation.
Organization health or organization readiness.
Oh, one type of observation also required how things are going. People are more following and all.
We can put overview.
So these are the factors we were just trying to create our thinking. We thought ki unconditional conditions would get created because of facilities, accessibility, competency, culture, training, obstacles, resources, lack of systems.
Oh yeah, good sir. Good synonym, good meanings. And
something was to come up, so we thought we'll create it. Good, I think, so
Very
good.
nice. Very nice.
Very meaningful, actually.
Yeah. Yeah.
Murli here, sir. Our understanding for the team as a whole here is that we have identified a sort of a roadmap, a sort of a blueprint, basics of what we are going to do tomorrow and the day after.
Yes.
In other words, these are all the inputs that we will do, sort of a risk assessment.
Yes.
So I thought I'll share this point so that all of us are in a common page. And we come prepared tomorrow for risk assessment for each and every slide.
We have discussed, yes.
That's right. Think loud and then think wild even, and then come prepared as to how we can assess the risk related to each and every factor, bullet points that we mentioned.
Yeah. So I have an appeal to make. Can we join tomorrow at 7 o'clock?
Murli here, I'm okay.
Yeah, I'm okay, sir.
I'm okay, sir.
Yes, sir.
Surujan,
Yeah.
Sure, sir.
Because because tomorrow and day after I believe that the amount of exchange of knowledge we would like to have, time should not be a constraint, and I don't want to rush and then completed. So I'm just taking a chance. If we complete early, it's good and well and good. But I want to have that contentment that we have done a good work.
Yeah, sure.
Any questions? We still have some time. So any questions you have? What is the approach we should do tomorrow for risk assessment?
Murli here, quick one. For all of us, we need to understand what really is, what risk is really, what does it mean?
Yes.
Many of us, if at all, with due respect to the team here, many of us get a mix-up of our understanding between, for example, risk and hazard. What is a risk? That we need to define ourselves, and there are many indications available, and the standards are also available. I don't want to point out anything without the permission of Mr. Seshadri here. He's the
So
lead.
we'd like to listen to you. You educate us now today. Let us prepare a ground for tomorrow.
Okay.
Please explain what is a hazard and what is a risk,
Thank
and how do we structure our thoughts tomorrow.
Thank you very much. My first thought that comes to is one of the ISO standards, the series, ISO 31000 series, which has typically, ISO 31000 and ISO 3110 and ISO 31009. But I would say you focus only on 31000, where it clearly indicates what is risk, how you assess risk, and how you mitigate risk. Have a very high level understanding of how risk is being managed, threadbare, how a surgery is being done. So those things we will understand if you run through it. Otherwise, just run through any Google search of ERM, Enterprise Resource Management stuff. We will know what is to be done as an assessment, and later on we do mitigation. So those things will have a basic. Then having the template in our mind, then come to the PPT slides that Mr. Seshadri has prepared. One by one you apply, or as a group. For example, a factor you take as a group and then apply a risk assessment. This is one of the ways of doing it. Normally what happens is risk management means we assume that, oh my God, all the 100 risks related to COVID-19 should be taken with the same seriousness. It's not that necessary. You need to prioritize it. Identify the risks, analyze the risks, prioritize the risks, and assess what is going to be the impact of those risks. Some risks may give very low impact. Some risks very, very high. So that the typical matrix is there in terms of yellow, green, red. By doing so, but it's all a high level for stuff. But that will come under risk assessment. Then the mitigation part of it is the next sub-act of risk management. In terms of there are 4 T methods. T for transport. I mean, how you mitigate. I have a risk. How you are going to mitigate it? I want to transfer the risk. I want to terminate the risk. I want to treat the risk. So that sort of a thought will come in if we go into ISO 31000 as a preparation for tomorrow's session, please. Thank you very much, sir. Thank you, team.
When did you undergo the training on 31000?
I was delivering ISO 31000 risk management workshops in Dubai, Sharjah, and Egypt. One-day workshop on risk management, sir, covering all the 31000 ISO 31000 series as a whole, including.
When was this? When did you get trained?
I got trained on my own because I was delivering IRC lead auditor programs for ISO 9001, 14001, 45001, and 27001. So risk is a common factor in all these standards. So I picked up on my own and I learned on my own and conceived a program, designed a program, and then started delivering with the approval of my organizations in Dubai. Yes, sir. Thank you. So underline is ISO 31000 series. I request the team here. It's going to be even this course and beyond this course, risk management, ISO 31000 series. Thank you.
Anybody else has undergone a formal training of ISO 31000? Hello?
No, sir, I couldn't.
Madheshwaran? Vinod?
No, I have not been.
Parvati?
Internal company FMEA program only, Sheshadri sir. Not the ISO.
Sir, I have conducted a risk assessment for QMS ISMS, EMS, and OSHA, sir.
No, no, no. My question is different. Like I got an opportunity to undergo a training on ISO 31000 at Bangalore way back in 2013. It was a 3-day workshop. So I'm asking you, did anyone get an opportunity to undergo a training on ISO 31000? Because that gives because all these learnings helps us, create insights. Like the kind of understanding Mr. Murli has, it would definitely help us. If you get an opportunity to undergo a training on ISO 31000, I think you should go for it, actually.
Yes, sir. Sure, sir.
Mangesh, sir. Mr. Mangesh.
Yes, sir. I have undergone, sir. I have undergone training.
From where, sir?
I went from Intertech, sir. Intertech has conducted in Bangalore online.
Achha, it's online. Okay, I did a physical workshop, 3 days. Mangesh sir, tomorrow we want to do the risk assessment part of it. What is the approach you suggest?
I think Mr. Murli has given a very good overview. What I would suggest is we have a table and put each and every item there, and then the table will guide us. What should be the risk? What is the occurrence? What is the severity? What can be the the consequence? Things like this. In COVID, there is only one major consequence, sir. If there is a case in an MSME, the MSME will close. They will not allow to operate. The whole thing will have to be sanitized. So this is a very big risk. I don't think the people understand this risk. This is what we will have to highlight in our consultancy or auditing. Best way to go is by a table, sir, like you have done for our process approach.
Thank you. Hello. Mr. Ajay.
Yeah, sir. Can we just prepare one self PPT for this tomorrow's session? So everybody will identify the risk and what will be the other factors. And then one by one, we can take this PPT and we'll discuss on it. So there will be mix up of views from all of us. This is my suggestion. Just that one.
The reason I'm trying to facilitate is to avoid confusion.
Okay.
And have a lot of clarity. And we bring ourselves here and then be focused for 2 hours and put in our best and come out with something outcome which can be used and for the benefit of industries. So I don't suggest any homework now. What I am trying to suggest is, I have certain thoughts in my mind. It's not that I don't have, but I'm just trying to validate my understanding. Is there a way, or I can always change my approach. I can always correct my understanding or framework, but I'm just trying to have a gauge of what do you think, what format we should have. We already have unsafe conditions. We already know what are the unsafe. These are all.
Yeah. Sir, we can just go through the issues. Then what will be the risk? What will be the severity of that risk? Maybe what will be the effect? And then based on this impact.
Can it be very simple?
Sir, this is Murli, team here. My suggestion, rough cut thought coming up due to the availability of the time for us for tomorrow, say about 2 hours plus. As you rightly said, it needs to be very simplistic. A rough cut thought from my side is have an Excel sheet. Whatever in the PPT you have mentioned with the headlines, you make a section A, B, C, O, and then in every row, bring in whatever the PowerPoint points you brought in, just copy and paste. This is one column. And the right column, you make the severity of this particular issue. Take, for example, lack of competency. What is the seriousness? In a scale of, say, 1 to 10, giving an eloquent, give some sort of a ranking. Next one is the consequence. if the competency is not there, if the severity is at the scale of 4 in a scale of 1 to 10, what will be the consequence? Oh my God, it's going to be 9. I have all the resources, I have the people, I know I follow the regulatory requirement, but I don't have people who can even take the right temperature. Gone. Every effort is gone. In other words, a multiplication of severity and the consequence will lead to the ultimate impact where we rank. In other words, in Excel sheet, column A, you list out whatever we made in the PPT, sir, and then next column, say about 10 columns, higher level, you make it a severity. Under severity, you write 1, 2, 3, 4, 5 as a scale. And the next bigger column is the consequence, severity and consequence. Consequence also 1, 2, 3, 4, 5, 6, 7, 10, 10. Multiply this into this. Last column, major column is the impact or the risk assessment. In other words, in 2 hours, 3 hours, we can do only this much. Having done that, if we complete that exercise, say for example, 5 to 6 pointers, 6 rows, some will give an impact of, say, for example, 12 at the last column. I mean, 12, 18, 22, 32. Then you prioritize that. Then you will know, oh my God, this is the highest risk. I should attempt that first. I should focus that in terms of mitigation. In other words, if we have 100 risks, we don't think we should focus all the 100 risks with the same efforts and energy. So this is what my thought. Excellent. Thank you, sir.
Sir, you were to explain what is the difference between a risk and a hazard.
Oh, risk is the starting point. Hazard is the end of it. Risk has two impacts. Oh my God. Sorry. Risk is defined as effect of uncertainty. Risk itself is not uncertainty. The effect of uncertainty is the risk. Coming back to the point, risk is effect of uncertainty. The effect, underline that word effect. Effect could be positive or negative. The negative effect of an uncertainty is known as a hazard. The positive effect of uncertainty is known as opportunity. A risk may provide an opportunity as well. In other words, to quickly say, risk, for example, the negative risk of uncertainty is known as an hazard.
Sir, I have one additional thought. Ideally, for all of the circumstances, situations, constraints, what we have listed on, we have actually built a risk scenarios database, right? More or less.
Correct.
And each company needs to assess on these lines exactly what Mr. Murli said. On each row, they will need to think through, put mitigation, put their contingency plan. As this team, right, as this consultant team, should we look at what is permissible, what is not permissible, and give them a heat profile for an organization if we go and do as a consultant team an assessment? Will that be more appropriate, or should we assume that we are in one company and start assessing and put down things? So I just had a thought or a question on this one, right?
Prakash here. Some already standard practices are available, which is being followed across the companies. That is basically the RPN number, severity occurrence detection, and rating has also been standardized for that. For like one rating, the description could be very low or none, and criteria is depends. The team can discuss upon that. So we already have a standard established system available, so we can carry on with that because that is easily acceptable to people and results are also acceptable to people. And RPN is basically being followed in FME studies also, risk assessment also.
Okay, let me digest it. And, see, my contention is availability of time of MSMEs towards this activity. We'll have very limited time to handle this, and how effectively I communicate them about the impacts because of this action, because of this unsafe acts and conditions, and make them to counter it. See, the purpose of all these things is they should take preventive actions. They should install preventive practices. So approaches could be many. There could be many tools. There could be softwares. There could be many standards. I am trying to see from a business owner's perspective. I'm trying to see from the competency of the people in the organization's perspective. Plus, I'm also trying to see the time availability for consultants and auditors. If yes, if you have Infosys coming in and asking us to do an activity, yes, whatever you are talking makes sense. But a small organization with 10 employees, 15 employees, 20 employees, I fail to understand whether they'll appreciate this. They know the important. They know its importance. They know it's essential. But I'm not sure that they can give that much time or weightage to this effort. So how do you make it easy for ourselves, make it easy for the entrepreneurs around, and also make it a practice which creates an earning opportunity. So let me think, and I have taken a mental note of notes of all of whatever interactions we had. I have certain thoughts in mind, but I am not. I'm trying to only place it well. Yeah, someone was trying to say that.
Yeah, Mangesh. I have one sample, sir, which is very easy to communicate, easy to understand. It is by Texas Medical Association. I will forward it to you. So you can have a look and see whether we can use it tomorrow.
You can post it in the group, sir. I will give you because let the group decide.
Okay, sir.
I'll give you access permission to post.
Yes, sir.
Otherwise, that good mornings and all these things will come. So I'm scared of that actually.
Or I will send it to you by email and you can post it, sir.
Yeah, that's fine.
Okay.
So good night to all of you. We'll assemble tomorrow at 7. Thank you so much. Both days we'll have it 7 to 8.
Sure.
Good night, sir. Thank you, sir.
Thank you.
Thank you.
Thank you.
Thank you,
Good
sir.
night, sir.
Thank you.
Good night.
Good night.
Bye.
Sir, 7 to 8 or 7 to 9?
7 to 9.
Sir, you'll be sharing this today's session content.
All together in one go.
Okay. Okay, sir. Yeah. Thank you so much. Yeah. Good night.